Rand Paul unveiled an Obamacare replacement. The Hill has the details for us here. They explain, Paul's plan includes a tax credit of up to $5,000 per person to use as part of a health savings account to pay for medical care. That tax credit appears to be larger than those offered in other Republican health care plans. The plan would abolish many of the central elements of Obamacare, including the mandate that everyone has coverage. It would eliminate the minimum standards for which health services and an insurance plan must cover, which Republicans argue would allow for cheaper, less comprehensive plans. It would also eliminate some of Obamacare's protections for people with pre-existing conditions. Instead, Paul proposes a 2-year period where people with pre-existing conditions would get coverage. After that, people with pre-existing conditions would be protected if they continuously maintained coverage. Okay, let me be clear about something. I like Rand Paul. Rand Paul bucks GOP orthodoxy more than anybody else. Rand Paul voted against Mike Pompeo for CIA head because Mike Pompeo is in favor of expanded NSA spying and was in favor of executing Edward Snowden. Rand Paul's an ally on some social issues, including drug policy. Rand Paul's an ally on foreign policy. So he's more libertarian-leaning than any other Republican politician, and he deserves credit for being right more often than they are. Having said that, on this, he's 100% wrong, and his plan is terrible. So, let me count the ways in which that's true. When you talk about health savings accounts, that sounds good in theory until you actually get sick with something really serious, and then your coverage is nowhere near enough. And you're fucked, and you might go bankrupt as a result of having to pay for medical care. Any system where people go bankrupt for paying for medical care is a terrible system. We still have medical bankruptcies in the U.S. Medical bankruptcies was the number one cause of bankruptcy in the United States. Think about that. Medical bankruptcies don't exist in other modern nations. They don't exist in Canada or Australia or Britain or Norway or Denmark or Iceland. They don't exist. It's not a thing because it's paid for by tax dollars. It's a single-payer system. The government is the single insurer. So it's a bad idea just because it's still on the private market and it's not comprehensive. Okay, furthermore, when you say it would eliminate the minimum standards for health insurance plans, what that means is the catastrophic coverage plans come back. Now, the benefit of those plans, many people will tell you, is, well, I don't have to pay a lot and I get coverage. The problem with those plans is it's only catastrophic coverage. So unless you have something that damn near kills you, you're not going to get covered at all. Now, the people who like those plans are people who are lucky to have never been in a situation where they get really sick. Because they say, oh, I only have to pay whatever it is, $100 a month, and that's my health coverage. Yeah, but you're not even really covered. You're not. You're just not. Like, if something happens and you get really sick but you don't almost die, you're not covered, and then you might go bankrupt trying to pay for your medical bills. So there's a reason why those plans were banned. You're basically paying a mafia, that mafia being the private health insurance companies, and you get nothing in return. You're paying them for their protection, but they don't really fucking protect you. And furthermore, look, I need to attack this idea, this preposterous idea that's only an idea in the United States of America, that there's choice. There should be choice in healthcare and health insurance. Here's my idea of choice. Sick help. I'm stealing from the movie John Q with Denzel Washington. Sick help. Sick help. So there's no, like, what do you mean? You're not shopping for a fucking car. You want all-wheel drive or you want front-wheel drive? Huh? You want a sedan or you want an SUV? No. This is life and death. This is healthcare. If you get sick, you should get help. That's the end of the conversation. Well, you're sick, son, but according to your plan here, Clause 17D, you're not sick enough for us to pay for it. That is a bullshit, rigged scam of a system. It's a ruse of a system, and that's a system that only exists when you have the private health insurance companies in control, because they're trying to wiggle out of ways to pay for your care. So, no, there shouldn't be, choice. Now, I'm not saying you ban private health insurance companies, but you should have a Medicare for All system where everybody's covered, and then if people want supplemental coverage, where, you get coverage for some shit like plastic surgery or whatever, which is a totally elective procedure, then you get your private insurance coverage. But in terms of, for just coverage, here's your plan. Everybody's covered the exact same fucking way, and it's the best care that there is, period. That's it. Anything other than that, and I think you're being a fucking ridiculous human being who's trying to bend over backwards to accommodate rapacious, price gouging, for-profit insurance companies, private insurance companies, that have a financial incentive to not pay for your care as much as possible. That's how they make more money. That's how they pay at the bottom line, by avoiding paying for your care when you need it. So there's an incentive structure problem here, guys, and that's what I'm trying to stress. So it's a terrible idea to bring back the catastrophic coverage plans only. Anybody who's had them, who's actually who's gotten sick goes, oh my God, that was the dumbest thing I ever did. The only people who like them are people who have it and they haven't gotten sick yet. But when they get sick, they're going to be up shit's creek without a paddle. Okay. Furthermore, to eliminate the protections for pre-existing conditions. And what he's saying is, okay, no, you can keep that if you never miss a year. So you have to keep personally signing up for a private health insurance company. But if you miss a year and you try to get back into it, well, you fucked up. You missed out. Now, how many people would be kicked off of health insurance because of some paperwork problem? I had a paperwork problem the other week. I did a segment about it with my health insurance company. So if I had a pre-existing condition and that happened, guess what? According to Rand Paul's system, well, now nobody's going to cover you, and that's fine. You have a pre-existing condition. You try to get coverage again through somebody else. You can't. They have a right to say, we don't want to cover you because you're sick. So in other words, a system where people are sick, so because they're sick, you're not going to cover them. That is like literally the dumbest fucking system imaginable when it comes to healthcare and health insurance. Oh, the people who need the care? Yeah, don't give it to them. But the people who don't need the care, we'll cover them. Like, you pay us, and then maybe not, we'll pay you when the time comes. Guys, this is not an okay system. You're going to get, pre-existing conditions, that's not a thing, that shouldn't be a thing, that should never be a thing. Other modern countries look at us like fucking barbarians for ever having had it. Really? You're going to not cover people because they're sick and they need the help? Because it might cost you financially? And look, that's their only argument. That's what they admit. Well, it would cost us financially. And? Like, what are you talking about? That's like saying, I'm going to pay for this car. Yeah, but then I lose the car. And? That's the point. You're a car salesman. That's the point. You're a health insurance company. Like, you're got to cover people. Yeah, but they really need it, so I'm not going to give it to them. So what? They really need it. That's all the more reason to cover them, which is why there shouldn't be. God damn it, why do I have to make this argument in 2017? I want to bang my head against the wall. There shouldn't be a system where it's a question as to whether or not you're covered, and you might be rejected in some situations for pre-existing conditions. You need universal single-payer Medicare for all, and you need it right now. And if you don't have that, the very least they could do is not roll back the clock on Obamacare, which is a Band-Aid over a gangrenous wound. But they want to remove this Band-Aid with a wee bit of ointment on it over this gangrenous wound. That's what they're trying to do, and it'll make it even worse. So they're not trying to fix it, they're going to roll it back in the wrong direction. The answer is to add on to Obamacare and eventually make it a single-payer Medicare for all system.